Hey everybody, Dr. Hayes Estes here, Premier Physical Therapy and Sports Performance. Just doing another little post here for our YouTube channel. This post is also going to go up onto our website and onto our social media pages. Today's topic, we're going to talk about the rotator cuff tear, especially non-traumatic degenerative rotator cuff tears. And do I need surgery? I've been told I have a rotator cuff tear. Do I need surgery? So here's the answer. No. you know what the answer is by now. Hopefully you have seen enough of these videos and you know that we're here to preach conservative treatment and how you can avoid going under the knife and pain medications and all the side effects that come along with it. So here's what the research says for non-traumatic degenerative rotator cuff tears. You know, that wear and tear you get. You've been doing a lot of working out for your whole life. You played a lot of upper extremity dominant sports. You're a golfer, you're a tennis player, and you got some shoulder stuff. Or you don't. You don't even have any shoulder pain, but somehow you've had an MRI that shows that you have a rotator cuff tear. Well, what the research shows, a couple of quick articles I looked up here, it's a couple systematic reviews. Kukkonen et al. They were in the did an article in the Bone and Joint Journal back in 2014, and a 1-year follow-up for atraumatic, non-traumatic rotator cuff tears. Operative treatment, rotator cuff repair, was no better than non-operative treatment for this condition at a 1-year follow-up in their study. Kuhn et al. In the Journal of the Shoulder and Elbow Surgery, 2013. They did a cohort study and a big systematic review of it totaled 452 patients. And what they found was that 75% of these patients who had full thickness, like the bone had become separated from the muscle, full thickness rotator cuff tears in these patients, 75% of them responded to conservative treatment. And the suggestion was that non-operative treatment was the course of action for these full thickness rotator cuff tears. So if you have a 75% success rate for something, we don't need to have surgery for it. Here's your worst case scenario. You go through physical therapy, you get a little stronger, you get a little range of motion, and we have got your pain under control. Maybe your function is not all the way there. Worst case scenario, you just did some prehab, and therefore that shoulder is stronger, more resilient, and it can respond better to the surgery. But again, 75% of the time, you do not need to have surgery. So if you have been diagnosed with a full thickness degenerative rotator cuff tear, and you are limited in your function, or you're even having pain and you're having weakness, physical therapy has been shown to be effective to achieve your goals, get you back to doing the things that you want to do. So, pretty short and sweet today. That was just a quick little 5-minute search that I did on the internet. As usual, I'll post those articles probably on our social media pages as well. So, if you like what we're doing on here, subscribe, share it, like it, show it to your friends, show it to your parents, show it to your kids, and spread the word of how physical therapy can help people regain their function. So if you can't do the things you want to do because of pain, stiffness, or weakness, you don't need surgery. You just got to get up there. You got to start moving. You got to improve your flexibility. And you got to improve your strength. So check us out, ptandsportstherapy.com. We're here in Clearwater, Florida. And we make you feel better. We make you move better. We're also on Facebook, Premier Physical Therapy and Sports Performance in Clearwater. Check us out on Instagram. We're also there at Run Tampa Bay. All right, have a good one.